Hi, this is Paul Tyler, and welcome to another episode of the Reimagine podcast. And today we're going to be talking actually about innovation in the employee benefits arena, which is a little different, but it actually is kind of an interesting story. And we met a very interesting company traveling all the way from Israel. That was how many months ago?
Yeah.
November, and they actually impressed a lot of us. And I don't want to spoil the end of the story, but we actually ended up with a very interesting pilot. So with that, Laura, do you want to make introductions and set us up?
Absolutely. It's so great to be back here with everyone today. And, it's a special treat to have some additional individuals from Nassau Financial Group with us today. But we're going to be working through a conversation, as Paul mentioned, in the employee benefits space with Wendy Hipsky, head of sales for Healthee. We have Jackie Bamman, Chief People Officer for Nassau Financial Group, and Gillian Maccarone, Human Resources Generalist. So, like I said, we're excited to have some Nassau voices with us today on the podcast, and want to jump right in. Wendy, let's start with you a little bit. Tell us about Healthee, what it is that you do, and how long have you been around for?
Yes, thank you. Hi, it's so nice to be here. So we have a very interesting backstory. As Paul mentioned, the company does originate from Israel. Both of our co-CEOs are ex-Israeli military. So they're not from the innovation space or the healthcare space. But the backstory is very interesting. My boss, who's one of our co-CEOs, him and his wife were expecting twins. And they were in the US. He was working for a large US company, had healthcare benefits from that company, and they needed to get a test done for their upcoming birth of their twins. And they really had a hard time finding providers in network, finding how much they would pay for these providers. And it was just easier for them to fly back to Israel to get the test and to make sure that everything was moving along in the best way, which it was. And he tells this story, so I'm not, infringing on his privacy. This is his story for how we were started. And he just really realized then that there has to be a better way. People in the US are just generally so confused about their healthcare and how to access just general information as to what their copays are, who's in and out of their network, what they're provided by their employer, because most of the time it's exceptional healthcare benefits. It's just a puzzle to put it all together to really be actionable and get the right care at the right time. So that was his aha moment. Came back to the States. He's got beautiful twin girls who are very, very healthy and happy. But that's really was the start of it, is how can we use technology in the way that so many other industries have transformed. We've transformed banking, we've transformed booking a vacation, shopping online. All of it is done in the palm of your hand on a device where you get instant information that you can use to go on with your day and really make the most out of your experience. So we really wanted to bring that to health benefit navigation. So he assembled a really incredible technology team. Our tech team is still in Israel, and our sales and marketing and client-facing teams are here in the States. And we're just on a mission to really help employees understand and access their health benefits, and really resulting in just being healthier overall. We want to make healthier employees, healthier organizations, healthier communities. So that's our mission. And we're so glad to welcome Nassau to our mission and really be able to impact and help their employees as well.
And Jackie, maybe you could just sort of take a step back and tell us how important are benefits for employees, and how has it changed in the last couple of years?
Well, good afternoon, everybody. Happy to be here with you all. I mean, clearly benefits are critical to employees' compensation packages. They've changed a lot in the last couple of years from the perspective that people are much more focused on health in many ways than they had been, and not just their physical health, but mental health. And so it really, runs the gamut of a holistic, healthy existence. And although we weren't hearing a lot of problems our employees were having, I'm always happy to present something that makes life easier for our employees, and really was intrigued with what Healthee offered, and wanted to give it a try and see if it would be sticky with our employees.
Yeah, and the backstory, and Laura, maybe fill us in, is Kobe Bendelock took a huge contingent of Israeli startups on sort of a U.S. worldwide tour, and it was the timing was kind of perfect because Jackie Wright was right between these COVID waves, and we hosted them in our building, in Hartford. I think we're one of the few insurance companies actually that were open at that point. We had so Laura, maybe talk about the event and kind of how companies came together.
Yeah, absolutely. And technology was mentioned today, and we're going to mention it several times. But for me, in my story, during the time when Kobe and his group came down to the States here, I was actually at home because I had just had my daughter. So I was able to stay connected to the event. So we had worked with Kobe and the group leading up to the November timeframe. And it was fascinating not only to work with Kobe as an individual who is constantly bringing some of the best and brightest innovators to the U.S. and to our doorstep, if you will. But it was unbelievable to watch, even through my screen, how the entire event unfolded. So if you can picture inside of an insurance company, delete whatever that image is. And now picture this really amazing two-sided glass building with innovators coming together from around the world to have a conversation and to be warmly welcomed by, there's the mayor, we have C-suite, we have other people within network, it's other corporates, other community. So Hartford's a really warm place for innovation to take place. But when the startups came on stage and were sharing their stories, it was remarkable, not only to hear the solutions that they offered, but also the personal element, which is another reason why we love doing this podcast series so much, is we get to learn about Healthee. We get to learn more about people like Wendy doing this amazing work. But when Kobe came a knocking and said, listen, I'm going to be in the US, I'm going to go to New York, I'm going to go to Connecticut, and I need to bring this group. We were very excited to partner with him yet again and to have the set in. And this relationship actually came from that evening. So you never know, right? As an innovator, if you're sitting there wondering, should I make that call? Should I, set up that Zoom? Should I go to that conference? Should I go meet with these people? The answer is yes. Because you may have a story like this where Kobe contacts, us. We say, come on down. The group shows up. Connections are made. And this isn't the only one that was made that evening. But because of that outreach, and again, like I mentioned, I got to watch it through the screen because we were live streaming the entire event. So not only was it for the people within the space, but it was for people across the world. And we had really good interaction, not only from, people on site, but people from around. And it was, we're here today talking about it because of one phone call. So if you're ever wondering, make the call.
Yeah, no. It was a great presentation, by the way. But what struck me even more afterwards, Jackie, was a couple of people in the audience who worked for us said, "Paul, this would be great if we had it here." So maybe Jackie and Gillian could sort of talk about, what made this stand out. Why take why put this in front of the company? What was it that about their offering you thought that really so this is something worth trying?
So I'll quick jump in here, Gillian, then hand it over to you. One of the things that I was intrigued about is first off, Paul, I fully support our Nassau Reimagine program. I've been kind of involved in the periphery since we kicked it off and always looking to see what could we bring in to our organization that would help our organization, but also help the startup environment and community. And that was, really where I was coming from. It's a win-win, right? I'm always looking for, new things that we can offer employees that make life, just a little bit easier. But I was really intrigued about this company and what it was that they offered. I mean, we have Cigna as our healthcare provider. We have an 800 number people can call to get support. But it's a bit of a challenge sometimes to find the answers. And so I was intrigued by this, Zoe, this system that takes all your benefit information and gathers it up, and you can type a question and it will answer it for you. And so that was kind of where I was coming from, win-win, right? Something for the employees at the company, and then also how can we as Nassau support the startup community, which I was very intrigued about. And I'll let Gillian speak for herself, but Gillian's always been intrigued by the Reimagine program also, and it was a way to get her involved.
Yes, I completely agree. I'm always happy to see a member of our incubator program actually come into the fold with Nassau and see the synergy between, the program itself and us, operating behind the scenes to kind of help to make them successful and see how we can utilize different programs that they have. But also to me, I was intrigued by Healthee merely from a benefits administration standpoint. HR were the first point of contact for our employees when it comes to their benefits. As much as a lot of HR departments want to say that they want to kind of migrate their employees more towards the carrier, the fact of the matter is there's a certain amount of trust between, your HR department and the employee. So they tend to come to us. And while we're more than happy to do the research and to help them and to get them in contact with the right people, being able to give them an additional tool to help them navigate their benefits options just makes the experience so much better for the employee. And if you look at the way things are operating currently with tech, having AI software available to our employees to help them find out what level of care they can achieve, how much is my deductible going to be? What is my HSA going to cover? What is not? What will it not cover? Anything along those lines. It's just a nice thing to offer to our employees. And I think having this type of software in place is also wonderful from a recruiting perspective. We don't just have a great benefits plan, but we also have these new tools in place that can help you to better utilize your healthcare. And it's interesting to, employees and to new recruits. So I was more than happy to jump in and help to get that implemented.
And Wendy, as we were, opening up the conversation, talking a little bit, you talked about how there has to be an easier way to solve the puzzle, right? So it's a tricky puzzle, as Gillian mentioned. There's a lot of elements to it, and even going through it in my own experience just a few months ago, it was email after email after email, and I could have called Cigna, sure, and I ended up doing that also. But I really did reach out to HR quite a bit for guidance and help there. So Wendy, tell us a little bit more about, the customer experience. You talked about digitally enabling people to utilize their information and to, let's say, better themselves through their healthcare. What other success stories or stories have you come across that you could share?
Sure. And that's exactly it. You can call Cigna, but you also have vision coverage. You have dental coverage. That's a different number. And that's a different phone number. You have ancillary benefits that your employer offers. That's a whole different, pathway to get to that. So what we want to do is just pull everything together. And like Jackie mentioned, we absorb everything into our platform. So there's no link outs. We keep everybody right within the Healthee platform. We have all of that information ingested into the product. And then Zoe, who is our digital AI navigator, is able to instantly give that information. And we've had great success stories of people finding out that if they get allergy injections at their PCP, it's covered 100% or with a $10 copay versus going to a specialist where it's $100 out of pocket. So it's just that kind of navigation and care, I think, is just so important. We're seeing this transition and transformation, especially with the entire great resignation and now people coming back to work, that they really are insisting on the highest quality benefits. They want ancillary benefits, fertility, maternity, mental health, all of that is so important. So they know to ask the questions and they know to really look to see high level what that employer offers as an investment in them. And the employers are going through great lengths to develop these benefit strategies that are just wonderful strategies. But then something happens in the transition after open enrollment or after hiring. They make the selections, they see everything is there, and then it goes out of sight, out of mind. They're not using it. So it's like, how can we be that sort of interface, again, digitally savvy technology people like to use, that's a positive experience that gets them to what they told their employer was important to them to start with. They really looked at different employers, different health plans. They got what they felt they needed for their family to take the best care of the family, but then somehow they're not using those benefits. So how can we really, not only take them down a path where they're using it, but it's a positive experience. They want to come back. Every time somebody interacts with Zoe, we want it to be very positive so that the next message or alert that they get from Zoe, they know right away it's in their best health and it's what's important to them to begin with. So, that's really what we try to do is make the experience complete from what they've asked for to what they're actually using to improve their health.
Okay, Wendy, we have more Alexas around our house than I would care to admit to anyone. Alexa's great at certain questions, right? What temperature is it? What time is it? Oh, what is Costco open? And then it will do just the craziest things with some of these questions. You'll ask it. Tell us what are the type of questions where Zoe just nails it? And then honestly, what are the type of questions where better talk to Gillian?
Yeah, so that's a great question. And when we first started talking about Zoe and developing the platform, we wanted Zoe to be the Alexa of healthcare. So it's like we want everyone in the United States, when they had a question, to ask Zoe. Just like you ask Alexa what the temperature is outside. So in addition to Zoe, and Zoe can anything that is outlined in those long healthcare evidence of coverage documents that nobody reads, nobody wants to read. You know, they're good sleeping material if you can't sleep. But anything that's outlined in those, we ingest into the technology. So line by line, we make sure that everything is in the product. So what are my copays, coinsurance, deductibles? What kind of care do I have? If I have a migraine, who can I see for that migraine? So we make sure that all of those are outlined very succinctly. Where can I go get this care? How much will the care cost? All of that Zoe knows right off the bat. If there are complex questions or just things that aren't necessarily standard as an outline of coverage, there's a whole data team behind Zoe. So we monitor every single question that comes into Zoe to, one, make sure she gave the right answer, because we want to make sure she's doing her job. And then two, if she does not know the answer, she'll tell that member right away that she needs some help, and she's going to ask her data team. And then we take that, and our data team either goes back into the documentation to find the answer if for whatever reason it wasn't a standard answer that we had in the product, or our data team will even call the carrier. We'll call Cigna. We'll get an outline of coverage if it's non-standard coverage. And then we're able to return that message to the person that inquired. And then also, because it's technology, we can put that information right back into Zoe. So the next time somebody has a question, Zoe does know how to answer. So the more we interact and the more we serve the members that are asking questions, the smarter Zoe actually gets too. So she's the front line, and then we have a whole team of data experts that are behind the scenes to make sure that we're getting all the right information to the right people when they need it.
So Jackie, if Zoe were a person you hired to do benefits, how's she doing? What's her 3-month review look like?
So we're only a few weeks in, so I don't have a 90-day look yet. One of the challenges of any new technology is in ensuring people remember to use it. And so we're at the early stages of working with Wendy and her team to ensure we get the information out there to employees to remind them to go use Zoe. The HR team was playing with her before we had launched the software to the company, just to try it out and see what questions were being answered. And to what Wendy said, many of them were. And now we're sending frequent reminders out to the organization to, don't forget, if you have questions, jump in onto Healthee. We're trying to get a chiclet on our Microsoft app site so that it's an easy access. We want to make it easy. And so we got to give it a little bit more time, but I was poking around and she knew some of the answers to the questions I had.
So Wendy, besides NASA, who is Healthee's ideal customer? Who are the clients that you're seeking? Say we have listeners on, I'm sure they're intrigued at this point, wanting to get to know Zoe and wanting to know if Zoe can answer their questions.
Yeah.
Tell us a little bit about that.
It's such an amazing time to be in this market, because we say our ideal customer is anybody who offers health benefits to their employees, because, the general consensus is it's a terrible experience all the way around. Most traditionally, we've been most successful with, again, innovative companies themselves, companies that are looking for innovative solutions. We work with a lot of other technology companies in the space. Our investment team has several technology companies that we're working closely with too. They're more on the financial and real estate side. So again, they're growing very quickly, have a lot of employees themselves. We also have success with, again, because of our roots being an Israeli company and transitioning a lot of folks to the States, getting healthcare for the first time in the United States. what is this? So we've had a lot of success too with helping companies like ours where they're transitioning workforces into the States, giving them healthcare and helping guide them into the system just right from the beginning so that they know what to expect. We've been working with a lot of brokers and consultants. They really do see this deep value because, again, it's one of the pain points, especially in smaller size companies where there's one HR person to answer all the questions and they can spend a considerable amount of time there. So, where the demographic is wide, but mostly innovative companies, they see the value right away. They get a lot of questions. They really see that they need something that not only, helps their HR teams, but it empowers their employees. Sometimes health issues are very sensitive issues that people don't feel comfortable letting their HR team know right away, even though, again, all of the initiatives that have been done around diversity, equity, and inclusion, of course, there's still some very sensitive health issues that I don't want to share with my employer until it's time. So it gives people, again, it empowers them to find the right answers right away and then be able to share their story when they're ready, if they need to really empower them, I think.
It feels like, benefits are probably even more part of a recruiting discussion than they ever would be, Jackie. And I wonder, do you think Zoe could be a recruiter? I'm thinking, we're working on your web pages, right, on the HR side. How far away are you from actually opening that up to somebody just say, no, I actually want to ask about the benefits package? Is that something in the feature package that's a possibility?
Yeah, it's an interesting thought. I mean, obviously everybody has to understand how the benefits apply to them personally. So I'm not sure till somebody's really in and on board, they're necessarily asking certain questions. But yes, I can see someone saying, what are the maternity leave benefits and what coverage do I get if I'm, about to have twins? And so it's an interesting thought. I think right now Zoe is applicable to a particular individual. So it's not necessarily general questions, but maybe we can have our HR recruitee profile that's just the overall, and we can share that with new hires that have questions. It's a good thought.
Gillian, tell us about the training. How involved are you in sort of training this thing or reviewing the answers that are coming through? Are you seeing the questions that anonymously that people are asking it?
No, I am not seeing the questions that are coming from individual employees. I will say that during the implementation piece of it, I was highly focused on Zoe being able to answer questions. So I was sending in weird things like I broke my toe, or I need my wisdom teeth removed, or I'm having a baby, like really trying to cover a gambit of different problems that people could run into, or I have COVID, number one question probably these days. And I actually reached out to my HR team and I said, hey, can everybody give me 5 to 10 questions? We want to throw as much at Zoe as we can to help her come up to speed on our benefits plan. And not only that, but how to answer these questions. Because the fun thing about Zoe, in my opinion, is that she is always learning. So if she doesn't know the answer to the question, that is perfectly fine, because we know that there's a team of experts behind her that are going to find the answers and then teach Zoe. So should anybody say, I have COVID and I stubbed my toe and I'm having a baby, help me, then she will be able to properly answer the question. So as far as I know, we don't have any visibility into employee questions. And I think that's a good thing. People do deserve to have their privacy, even with AI software.
Absolutely.
Mm-hmm.
Yeah. And Wendy, I'll put you on the spot. I know you're really focused on sales, not on the development side, but, AI is fascinating. I mean, I think there's a New York Times article out yesterday I saw, just in terms of some of the advancements of AI being able to actually write material. In terms of reading, how specific is your technology just to benefits? Like, for instance, our call center gets, I don't know, Jack, you probably know the number better than I do, 50,000 calls a month or something. A lot of the stuff has to do with, well, tell me about the feature of my particular policy. Suppose we gave you all our annuity contracts and said, okay, go figure this out. Somebody has a question about it, go read it. Is that an entirely different, language problem? I mean, how specific is your AI to employee benefits?
Yeah, so any health-related employee benefits is really what we're focusing on, and that's what we're building the language database. And you're right, I am not a tech person, so I know enough to make me dangerous. But right now, we're really focused on people's health. And so anything that impacts their health, any resource that they have that improves their health or supports their health is what we're looking for. So, even things like EAP programs, where a lot of times mental health is brought into that, into different other ancillary programs like musculoskeletal health or fertility, pregnancy. So anytime anybody has a health related question, we want to be able to look into the database, go through the benefit design, as well as any ancillary health tools, and give people a really comprehensive view of what they're offered through their employers. So, looking at some of those other benefits that life and short-term, long-term, we get asked a ton if we're ready to pull that in. Eventually, we will be an entire platform for that. But because there's so much detailed work underneath where, Zoe does need to speak a healthcare language first, and she needs to understand if somebody's saying, I broke my toe, what that means, what they're asking for, what the inference is. Okay, they're looking for care first. Then they pick the care. Okay, now they're looking for information around cost. So there's a whole sequence and series of ways to put the health connections together. And that's really what we're focused on right now. And then as the product continues to evolve and mature and the language becomes more clear around the health side, we could definitely pull in additional benefits.
So Wendy, in the last 2 years, how has the pandemic impacted, the growth of Healthee or the language of Healthee? Have you seen, increase in utilization of the product?
Well, we've only launched last fall, so we were sort of on that tail end. We did see, though, a very specific surge in questions when we launched around COVID care, around COVID information, resources around treatment, as well as vaccines. So of course we saw that. I think too, what we kind of prepared for and really moved towards is that disconnected workforce. So most times you're not seeing that HR team anymore because you're not in the office. We hear a lot from employees that we talk to is they're not even sure who their HR representative is, only because they're focused on so many different things. And again, they really focus at open enrollment, and then it's out of sight, out of mind. So we think that we're really able to help keep people connected to their health in a more disconnected workforce. And that's one of the things that we really strive to do. Like Jackie said about the communication, we also are constantly sending out communications from Zoe to remind people that the benefit is there. Did you know in January we did, even though your deductible has restarted, all your preventive care is outside of that deductible. It will not cost you anything. People don't know that as a norm. They think their deductible started. They can't, for any reason, go to the doctor until well into the year, until they start to have to go and then accumulate some cost. So again, we're constantly educating people around different information of their benefits so it can be used, and helping that team that's now, trying to really support a workforce that could be all over the country. So we feel that it's another great tool to connect teams where it would have been really hard before to connect those teams.
Yeah. And Jackie, question for you, which is, look, this is a highly regulated space. We've got a lot of employees. This information is critical for a lot of people. Great to have a good idea in a startup. A whole nother thing to get a contract, get in the door with an insurance carrier. What did Healthee do right? If you were to say, give advice to other startups, what were the top 3 things they did that, led from a discussion to, hey, we're actually putting it in front of our employees?
Great question. And I think one of the most, one piece that really helped us move to the decision to do this was to give it a try before we actually have signed on the dotted line. And that was important because I don't know how sticky it'll be. I love the idea of Wendy sharing that they're continually sending information out about employee benefits, but we're talking about a behavior modification, and that always takes time. So you need time to know if it's really going to work. And so I said, hey, would you be willing to give us a few months? Let's get in the door. Let's give it a try. And if I find the employees are using it, we'll sign the contract for a year. And I think, it's kind of the tough part of building a business. Sometimes you need to give something, just to get it out there. And I felt that, that made it an easy decision. I liked the product. I liked what it did. I liked how it worked. It's very, very easy. But I just was uncertain how we're going to get people to remember to use it. And that's sort of my one thing that we're keeping an eye on. I've been working with Yob Brody, who's our benefit well-being manager, and Gillian, and getting communications out, at least monthly. And then whatever emails we get from Healthee that hopefully don't go into junk folders, people can see what's out there. And, we're working hard to have there be easy access. And then I enjoyed their story. The reality is I thought it was pretty cool that we had these Israeli startups come through the building, through the company. I wish I was, could have attended the meeting. So I like that idea. I mean, Paul, you and I often talk about, so what's out there? Because anything we could use, what could, we could try out, and it made sense and it fit with, where I saw there could be a potential void. So really pleased to have, given it a shot, and we are determined to get the word out and remind people, whether new hires or our veteran employees, that this is there for them.
So Wendy, Jackie just mentioned the story, and I love to ask this question in every episode. What is your why? You could be doing anything right now, but you wake up and you do this every day. Why is that?
Yeah, so my why, I'll give you the short condensed version. So I'm a dietitian by trade. So I'm naturally a clinician, and I just naturally focus on giving people the right tools, helping them change their behavior, because that's the most important piece, and then really bringing it all together. So when I talked to the co-founders and first was introduced to Healthee, and being a mom also of a special needs child, so putting all those pieces together at healthcare, that was a full-time job in and of itself, and it continues to be. I just saw such deep value, but from both, tactical technology, cool side, but really at the bottom of everything that I do and my passion, what I believe in, it was helping people get the right tools and right resources that are generally so hard to come by sometimes. So for me, that just put all the pieces together, clinically healthcare focused, giving people access and improved tools to get the benefits that they have access to, and really help them use. It's just been my passion throughout my entire career. So that's really why I do it every day, is to just help enable people and empower people to be healthy, because that's my passion.
Oh, this is great. Well, hey, Wendy, thanks so much. I've got to give this a spin. I'll see if I can. I'll try to ask some tough questions. Let's see, Jackie. Jackie, thanks for your support. On a lot of these things. I look forward to seeing you at Stacy's event here the next 2 weeks. Wow.
Yeah, next week. Yep. Likewise.
Yeah, very close.
Thanks so much for having me. I appreciate it so much.
Yeah, Gillian, thank you. And I don't know, Laura, are we forgetting anything here? I guess.
Sure. So for those who want to know more, because I'm sure everybody does, we're going to put in the show notes links to the website, links to everything that we talked about today. So make sure to go out and check out Healthee. Reach out to Wendy. We'll have her link to LinkedIn as well, and start the conversation, because you don't know until you ask. And, they've been a great partner so far, and we're excited to see what we can do with them.
Yeah. So thanks for joining us. And we want to thank our listeners. Tune in again next week for another episode of the Reimagine podcast.